Right. Well, hello everybody. I'm Paula Whitehurst and I am one of the lead pharmacy technicians at Derby and Derbyshire ICB. So I'm going to present today on a programme of work that we have been involved in the Derby and Derbyshire integrated care system on improving pain management. Okay. So this first slide here gives some background on a group of medicines commonly prescribed for pain, which are called opioids. Examples of opioid medications are morphine, fentanyl, tramadol, and codeine, amongst others. And what I wanted to show with this graph here is that back in 2022, December 2022, on this graph you can see a dark blue column there, which is Derbyshire. And that shows that we were really high prescribers of opioid medication. And also the patients prescribed have been prescribed longer than 6 months, the majority of those patients. So it was really important for us to look at this. Now, this is an issue, and this is an issue because opioids have a place in the management of acute pain, such as post-operation or if you've had an injury. But there's very little evidence, no evidence of benefit in routine use of opioid medicines. Opioids are a really high risk medicine. They can cause harm, which the higher the dose you have, obviously, the more increased the harm. A MedSIP report, a MedSIP methodology report states that for every 62 people who stop opioids or do not start an opioid, one death can be prevented. So that's really pertinent. So on to my next slide. In January 22, we were approached by the Academic Health and Science Network. They are now called Health Innovation East Midlands. And they approached us to collaboratively work on a medicines safety improvement programme. This is a national programme of work, and the aim of that is to reduce harm from opioids. This work also ties in with the 5 steps that I've popped on this slide there on the left, which is a framework for optimising personalised care for adults prescribed medicines associated with dependence or withdrawal symptoms. So this piece of work ties in with that, and the Medicine Safety Improvement Programme addresses the most important causes of severe harm associated with medicines. Most of these have been known about for years, but continue to challenge health and care systems in England. So the key ambition for this Medicine Safety Improvement Programme is to improve care for people with persistent pain by reducing opioid analgesic use. So what we found right from the beginning of this programme of work is that looking at pain holistically is really, really important. And it's really important to support people with what we call the 10 footsteps. So we've worked with Live Well With Pain in partnership to adopt their 10 footsteps methodology. This methodology covers 10 areas, which you can see displayed on this slide. And all these areas, if people can work through those areas, the people that have got pain, these areas can support people who live with pain to live well with their pain. So they cover areas such as understanding pain, so understanding the way that the brain interprets pain, acceptance of living with pain, pacing as something that you can look at doing to help you with managing your life and your life objectives, setting goals and being active, doing exercise as well as can be done, relaxation and mindfulness, something around sleep, there's communication, there's managing moods, medicines and nutrition, and managing setbacks. So we've been working in partnership with Live Well With Pain, and we've had, I think it's 81 healthcare professionals, I'll cover this in a further slide, trained on the 10 footsteps so that when our healthcare professionals have conversations with patients in GP practice settings, they've got the skill set to be able to help people live well with their pain and talk around those areas. So this slide is around population health, and what I wanted to show here is that there are practices in Derbyshire that show a link between high prescribing and high deprivation, and we can see that link nationally. And we've been working with some of the practices in Derbyshire that are identified here to look at a targeted approach, a quality improvement approach, to look at reviewing patients prescribed opioids and how we can work to get those practices more below that line towards the low prescribing. So this just gives some programme details. So the work that we've been doing follows a change management cycle, and change management takes a long time. So we've been involved in this programme of work now for this is the third year. It's a 3-year programme of work, and we're in a phase now where we're trying to make this more sustainable as to where it sits in the future. But we started here in the setup phase. We built a picture, we did some scoping of what services and support we've got across Derbyshire for pain. We mapped the system, and then we started to hold an annual action planning event. So the first event was held in March 2023, and we held this year's event in February 2024. And that action planning event influences what we work on for the following year. From that, we've got a collaborative network, and we manage a network that help to deliver the things that we want to deliver for the year, and then we continue to produce action and then go back around the change management cycle. All stakeholders are involved to attend the annual event, so we reach out to anybody who's got an interest in pain, our healthcare professionals across the Derbyshire system, and we also invite any people who live with pain to attend that event and be involved in our planning. And we also invite carers as well. If anybody's caring for someone with pain, they are very welcome to come along. So my next slide just shows the intention of the diagram here on the left is to give a visual on how our pain management collaborative for Derbyshire works. So we have a delivery group for this opioid change management programme of work, and under that delivery group sit 2 working groups. We have a transfers of care working group, and we have a pain management initiatives working group. The transfers of care working group tend to look at the interface between how we work and what patient journeys are like between primary care and secondary care, so between hospital and GP practice, and also interlinking with community pharmacy. So we're looking at whether we've got good patient information leaflets there, whether we've got good policies in place for discharge of medications where opioids are given. And we are also looking at something called discharge medicines referrals. So these are information that is sent between community pharmacy and GP practice that we can look at. And we can look at how good quality those referrals are around opioids. And we're doing some work on that. The Pain Management Initiatives Group has developed lots and lots of resources. I'm going to go into those in a little bit more detail further on in the slides, and tends to have more of a primary care emphasis and supports our GP practice colleagues. We do have a mission and vision statement for this programme of work, which I've popped there on the right. So our overall vision is to support people to live well with chronic non-cancer pain while minimising the harm from opioids. And our mission is to work together as a system across Derby and Derbyshire to deliver improvements in pain management that can both enhance the care of people living with chronic non-cancer pain and reduce the harm from opioids. If anybody would like to join our collaborative community, anybody is welcome. So you can contact me if you'd like to join and be involved in this work. So after we have our actual annual action planning event, we've produced what's called a driver diagram. Now this is very busy, you'll not be able to read everything on here, but and that's not the intention. The intention is just for you to see how we plan and how we deliver the work from those action planning events that everybody contributes to. So deliveries via the 2 working groups. So on this driver diagram, we tend to categorise our work plans. So the green areas are for our transfers of care working group to take forward. The blue areas are for our pain management initiatives working group to take forward. We have a lot of emphasis on communication and comms campaigns, which is the purple bit. And then we're looking at making our programme sustainable and looking how we keep this going for future. The core group, our core planning group, have oversight of all the work that goes on, and then the programme is accountable to the Integrated Pharmacy and Optimisation Board. So just going back to Live Well with Pain and our partnership with the Live Well with Pain organisation. We've collaborated with Live Well with Pain and procured some training from them, and currently we've got 81 people across Derby and Derbyshire working in GP practices, also working in Derbyshire Community Health Services, and some of those staff work within our voluntary sector. We've got Derbyshire County Community Trust employees working with us, and also voluntary action groups too. Those staff, social prescribers, health and wellbeing coaches, we've got link workers, physiotherapists, and we do have a GP that also has been trained with the Live Well with Pain methodology. Many of these healthcare professionals have set up or support Live Well with Pain support groups for their GP practice or primary care network. We started off with one Let's Live Well with Pain group at the beginning of the programme, which was our Lister House surgery, and we've taken a lot of learning from their pain support group, and we now have around 17. It might even be a couple more than that. We've got 17 Live Well with Pain groups established across Derbyshire, and I've just on this slide just popped where some of those locations are, but I think since I've written that it has actually grown to a couple more. So the practitioners that have undertaken that training have given some feedback on that training, and they found it really, really positive. So some of the comments you can read for yourself here, but a couple of them are around there's a health and wellbeing check tool and chronic pain explanations, which really work well for people in those conversations around pain. The training was brilliant. One person said the pace flowed really well. The knowledge and experience that it's given it has really had a good impact. Also, the lived experience input into that training has been valued by quite a few of the staff that have done that. The tips and techniques that are picked up and pacing techniques and setting realistic goals have been really, really key. And somebody put the course was good, the lived experience and the assessment tools were a good takeaway. So some really positive feedback from the practitioners who are now trained up with the 10 Footsteps accreditation. And I wanted to just play a short video of patient feedback. So people with lived experience of pain that have attended the support groups that we've got across Derbyshire have given us some feedback, and we've put that into a short video, and it's really, really endearing to watch, and it really does show the benefit that they feel from attending such groups. So I'll just play that for you now. So next I wanted to just go on to some of the resources that we've developed in our pain management initiatives working group. So one of the resources that we have developed is a pain management web page resource. Now, these web pages are located on our Joined Up Care Derbyshire website. The front page looks as you can see here on the screen. I've popped a link on the slides, and you should all have the slides to be able to follow those links and access those if you want to. This particular page has got 6 sections that you can go into there to look at various things about pain. There's a section on common pain conditions, one on services and support groups, which lists our local Derbyshire services and support groups that might be useful to those living with pain. Self-management, there's an area on self-management there. There's an area on medication for pain, and there's a little section on our work and some of what I'm talking about today. So please do use that, and please do advocate that to anyone living with pain. We hope that that's a useful resource, and we'd be really happy to take any feedback on how well that works in practice and whether everything is there that people require. Another resource that we've been involved with is something called Pathfinder. So many people may not be aware, but within GP clinical systems, there is Pathfinder pages that help clinicians look for resources that benefit patients, and there's some signposting in there as well for clinicians to signpost people to various areas. So we've been involved with the pain page within Pathfinder. We've been making sure that all of our resources are on that page for our prescribers and our clinicians working in practice across Derbyshire, so that they can benefit from those resources. We've also got some resources on our Integrated Care Board Medicines Management page. Again, these are more clinician-facing resources to help with prescribing, to help with tapering. So if there are patients that need to taper down safely off their opioid medication, we've produced a tapering guideline. We've also produced a quality improvement toolkit for GP practices to follow. We've got an opioid resource pack. A real big safety element was around repeat prescribing. So we've produced a minimum standard for opioids that all GP practices can adopt and follow, so that opioids are prescribed safely in a repeat prescribing process. And we've got Live Well with Pain course implementation and facilitation guides. So these guides are really helpful to our colleagues across Derbyshire that are facilitating and setting up those Live Well with Pain support groups. And we've got lots of tips and information in there to help them facilitate those groups. And then there's something around more information on this programme of work. This is just a visual of that repeat prescribing standard for opioids, and what that is, just for anybody that doesn't really understand that, it's a repeat prescribing standard. It's a set of common standards that can be adopted by GP practices, and it just influences safe opioid prescribing. And it's in the form of a flow chart so that practices can follow that in terms of when repeat requests come in. And that's just a picture there of the facilitator's guide that we've got some copies of that we can give to our staff facilitating Live Well with Pain groups. We've also been working with Live Well with Pain on some digital tools, and these are 2 questionnaires that have been developed that are actually on the Live Well with Pain website, and they are around health and well-being, and there's also one around medicines. We've actually created those in a digital format so that they interlinked with the GP clinical system called System 1, and that means that clinicians can send those questionnaires out to people who live with pain in advance of their appointment, and the question answers come back into the patient record, and then when the consultation occurs following that, the conversations can be based around those answers and what is more important to focus on for that person. So they're a tool that should really help with reviews and with discussing pain, and the people that are using that do find that of benefit in practice. We've also implemented an action plan, so an electronic action plan that we've again integrated into the system, that staff can work with a patient on, and then that person can take that home and work on it. So that action plan can be owned really by the person who lives with pain, and gives them some things to kind of take away to go forward with and work on. Those tools are being evaluated by Durham University, so we're doing some evaluation feedback forms to try and get a bit of an oversight how well they work in practice. But if anybody on the call today would like to trial those tools or use those tools, please get in touch. I'd be happy to share them. Other programme information is around, we've got some further information on Derbyshire patient stories and case studies on the Health Innovation East Midlands website, and I've just popped a link there if you wanted to look at those. We've got some of our health and wellbeing coaches talking around the Lister House Live Well with Pain group, and there are a few other videos on there that might be good for people to watch if you want to know more. And my last slide is just around positive endings, and that change is possible. So on the graph at the top there, we're doing some really good work, targeted work with practices, and we are trying to get those that are in that high prescribing, high deprivation area below that line and improve their prescribing. So we've got some quality improvement work going on with practices to make change and to drive that. The bottom two graphs just show some data on our opioid prescribing, and that you can see a gradual decrease there. We're going in a good direction. You know, there's little evidence that opioids are helpful in long-term pain, and that risk of harm increases significantly as you get above 120 milligram morphine equivalent dose per day with not much benefit. So it's really important that we look at this, and we are going in a good direction. And then I just wanted to end on really that going back to that MedSip methodology report that stated for every 62 people who stop opioids or do not start one, we can prevent a death. Some of our data, quantities of opioids prescribed from January 21, we prescribed 21,662 prescriptions for opioids. And in May 24, that's dropped to 20,730. Now, data is always a bit of a challenge because we have, patients who have stopped who drop off, and we have new patients that start and come in. So it is really difficult to gauge with data the benefit, but based on those numbers, which we think would be higher, taking the challenges into account, we've saved 15 lives in looking at that data, which is really positive, and we've really got to celebrate that. And high dose wise, we've reduced to 1,497 prescriptions compared to 1,660. And for those patients, we're halving that risk of mortality, which is really, really of benefit. So some really good work going on. There's a lot being achieved in this 3 years, and we hope that continues and we make this sustainable and keep this on the agenda. But thank you for listening, everybody. And if anybody would like to ask any questions, I'm quite happy to take them.
Paula, thank you very much for that. If you can please stop sharing the presentation. And Paula's details are on the final slide there, so if anybody does need to get in touch with Paula to do with anything in today's presentation, I'll just mention before we go to the Q&A, there are a couple of things in the chat. I've put something in the chat about the 10 footsteps, which I think are amazing, because everybody's a part of this journey, and I've actually shared that information with a couple of my family members, and there are also good comments in there about the fantastic feedback that you've been getting, showing the power of getting like-minded people with lived experience together, and also that it's a great idea to adopt a pre-appointment questionnaire. So if everybody can get any questions ready, there is one in the chat which I'll read out from Philippa. Is the long-term goal to completely remove opioid use for long-term, secondary and primary chronic pain, or simply to keep it to a benefit greater than risk level?
So opioid prescribing, I think our main emphasis is that it should be appropriate. So if the prescribing is appropriate, then we don't ever envisage opioids disappearing. But it's got to be appropriate prescribing, and you have got to assess whether the risks outweigh the benefits, which clinicians will do when we encourage them to do in those conversations. So where prescribing is appropriate and the evidence behind prescribing is in short-term acute use, prescribing more than 3 months for long-term chronic pain, and that's not cancer related or not palliative, there's a lack of evidence to support that, and that's where we are trying to work to decrease our prescribing. Does that answer that one, Philippa? I hope that answers the question.
Okay, Philippa may answer or may not, but we have another question in the chat from Claire. She asks, would this programme stroke training be available for use within a secondary care mental health trust?
Yeah, I would say as long as you have got a cohort of patients living with pain that you are working with, that you are supporting, then that would be appropriate for that forum, for that area. Yeah. If you want to have a chat with me about that, contact me and we can look at that. And we do have a tiny amount of funding that we may be able to support with, but we'd have to discuss that.
In regards to Philippa's question, she has said thank you and she agrees with appropriate prescribing, but says it's scary when a medication has given you some quality of life back to think it might be removed completely.
Yeah, and I think some patients have fed back to us with the 10 footsteps methodology, that some of the learning resources there that help you understand how the brain and the body deal with pain can really help you understand the benefits and the appropriateness of pain relief medications. That has been some positive feedback from some of that learning. But yeah, I think there is a balance, and I think only you and your prescriber can look at that and look at whether the risks outweigh the benefits, etc.
We have another question in the chat. How do patients access the programme if their practice does not have a support group?
And that's a really good question, because obviously whilst these support groups are getting established, we do have a little bit of an equity. They are growing, and hopefully as we go further along, more and more practices will set up support groups. I'm happy for you to contact me and inquire as to whether you have got a local support group. I can try and link you in with a social prescriber or a health and wellbeing coach if you are seeking a support group, or you're looking at where to signpost people to, if that's helpful. But we do not have them everywhere at the moment.
Okay, that's it from the chat. Does anybody else have any other questions? You can put something in the chat, or you can raise a hand and switch on your microphone. We do have another one in the chat from Philippa again. Are you aware that DWP, that'll be the Department of Work and Pensions, don't consider pain as legitimate if you aren't prescribed opioid medications?
Thank you for feeding that in. That's a really good point to note, and we do need to link in with that department. I'll take that back actually, Philippa. Thank you for sharing that. That's really interesting, and and we're also looking at whether pain could be or should be in the future a clinical condition on its own, but obviously there are other conversations and further conversations to have.
Are there any other questions? Philippa has just commented it's a problem because obviously we know how stressful it is to live with pain long term. think everybody here understands that.
Yeah, extremely stressful. And I think that's why we've put such a huge emphasis on that holistic, that support mechanism of the Live Well with Pain support groups and our social prescribers and health and wellbeing coaches really working in this area, because it is stressful, and it's really important that people are supported in the best way that we can.
Okay, any other questions? Okay, it looks like we may have come to the end unless something comes up while I'm talking now. In that case, what I'll do is start to bring things to a close. If anybody does, oh, sorry, we've just
Yeah.
received a last second
Oh,
question. How about finding out the cause of the pain?
yeah, and again, I think I know with one of our Live Well with Pain groups, Lister House model, we have a physiotherapist who does the triage in the first instance. So all patients are reviewed by the physiotherapist, who would look at whether any referrals need to be done or any other interventions need to be done before somebody goes straight to the Live Well with Pain support group, so that we make sure that we're covering finding out the cause of pain. That's just with regards to one of our models, but in relation to that question, finding out the cause of the pain is really important, and that would influence what is given for that pain. And again, that would be a conversation with your clinician or GP in practice, I think. And how can someone get access to any sort of pain support group? At the moment, the advice I can give from talking to our pain support groups that are community ones in our GP practices and primary care networks is it's probably best to contact your practice, maybe speak to your social prescriber or health and wellbeing coach if you can, just to see if there is one available. So I'd probably advocate to do that in the first instance. We are working with the groups to see if we can advertise them on our website or list some details, contact details on our website, but we've not got there yet. So that is a work in progress.
There is Philippa's put a comment in the chat. It's not a question, but you may wish to pass comment on it. She'd like to see more ongoing testing for patients. It does feel sometimes like once we have a diagnosis, our doctors dismiss any new symptoms as you have a label, go away. I appreciate it is not that clear cut. Myself, I have multimorbidity, so I am aware of how complex and overlapping conditions can be.
Yeah, and we can take that point forward, Philippa. And we do see that. We do see a crossover of different conditions within pain. I can empathise with that.
And we have another question. Are all written materials linked to accessible standards?
So I'm closely linked in with our comms colleagues. So the resources that we've produced have gone through our comms colleagues, who tell me that we do look at accessibility within when we are producing these documents. So I would say yes to that one. I've questioned this myself, and we also use reading groups. So we have patient reading groups that also give us some really good feedback on how well received those materials are and whether they are readable.
Yeah, within NHS Derby and Derbyshire Integrated Care Board, we also have a readers panel. So increasingly, different business areas, when they're putting out materials, are putting it through the readers panel, and the readers panel is made up of members of the public. So we can put it by members of the public to see how it feels to them, and develop the materials also in line with accessible standards. Okay, I feel we're at the end there now. We may get away with it. So if anybody, oh, Philippa's coming again. I will never get away. Are there any assessments of how things, oh, chat's coming the way. Are there any assessments of how things like the dioxin leaks from the old coal light has impacted health problems in people who grew up in the area?
think
She
that's
does say if that's
off my
topic.
topic. Unfortunately, that's off my topic, so I can't comment on that one, unfortunately.
Is that something where you might be able to signpost Philippa to somebody else, or?
I'll take that away, Philippa, and I'll see if I can find out where I can signpost you to.
Excellent. I'm going to give it another 10 seconds this time. Okay, I'm going to call it again. So there are no raised hands, there are no new questions in the chat. If anybody does have any further questions, then please feel free to either contact Paula directly using the details on her final slide, or you can email me using my details or ddicb.engagement@nhs.net, and I'll be able to forward any questions to Paula or whoever can get the answers for you. So now we've come to the end. I'd like to thank very much Paula Whitehurst for a really excellent presentation, some really useful stuff in there and some things that are going to help some people that I know as well. I'd also like to say thank you very much to our two signers today, Helen Blunden and Helen Brooks. And finally, I'd like to thank everybody who attended today. These sessions are put on for you, and we try to every month get something that is of interest to you as well. Feel free to raise to me any suggestions for future sessions, and we'll see what we can do. Do look forward, please, to the next Derbyshire Dialogue. That is going to be on the 9th of October, and it's called Living Well, and it's all about the Living Well Derbyshire service. But later today or tomorrow, I'll send an email inviting you to that, and there'll be more details on there. So thank you very much, everybody, for attending today.
Thank you, Paula. Thanks, Mark.